In December 2019, news emerged from China of a virus called COVID-19 that appeared to be spreading rapidly across the country. By the end of January 2020, the virus had arrived in Europe. By March, Ireland was in lockdown. Dóchas members, working in over 104 developing countries, quickly mobilised to plan their response to the crisis. In collaboration with their local partners, they got supplies of soap, face masks, and other PPE equipment to where they were needed most, often very under-resourced public health centres. It also became clear, similar to the lessons we had learned from the Ebola epidemic, that one of the most effective methods of tackling the virus would be information. NGOs started running information and education campaigns in local communities while trying to keep other critical programmes running. We all knew that the ongoing development in human rights and climate challenges hadn't gone away, they were only getting worse. Even before COVID-19, communities in East Africa had lost most of their crops from one of the worst ever locust infestations in recent memory. Countries in conflict refused to answer the UN Secretary General's call for a global ceasefire. Therefore, innocent civilians in places such as Syria, Yemen, South Sudan and Somalia continue to need vital humanitarian support. And 68 million people remain displaced, some in makeshift camps, others along closed borders. Communities were also facing growing levels of hunger. The World Food Programme estimate that the number of people at risk of starvation is 270 million, more than double the pre-pandemic figure. Globally, 168 million children were out of school during the first lockdown. Many, mainly girls, will never return. UN Women also reported a huge increase in gender-based violence, which they now call the shadow pandemic. Irish NGOs were there when they were needed, with the support of Irish Aid and the Irish public. Dóchas members, their local partners and volunteers adapted and strengthened their partnerships to continue making a real difference. And still the pandemic rages on. A third wave is sweeping across countries such as India, which has reported some of the highest ever daily infection and death rates. We know how vital the supply and delivery of the vaccine has become for all of us. We need to make sure the vaccine becomes a reality for everyone in this race to rid the world of this deadly virus. There is a huge amount of work still to be done. No one is safe until everyone is safe. But the Dóchas network has shown what is possible if we work together, if we learn together, and if we act in global solidarity.